Sunny Ping, consultant obstetrician and gynecology. So I've been talking a lot about gynecology. Today I'm going to go back to obstetrics. As many of you know, I used to do a lot of obstetrics, and nowadays I have reduced substantially. I still do obstetrics, but to the minimum. But I will wish to share certain things that I have experienced before over my many years of conducting delivery and over my many births that I had. So we're going to talk about something very close to my heart and something very interesting as well. And not many people probably know about it. And I wish to share some of these very interesting things about birth that I have experienced in my life. Okay, I actually reduced my obstetric load part mainly because of health reason, and I feel that no, it's enough already. My body cannot take it anymore. I'm not that young anymore. Okay, it's not easy to stop. I cried the day I told my husband that I probably need to stop obstetric. That was the day I cried. I really cried a lot for a couple of months. It's not easy to go over really. But anyway, with MCO, I'm kind of bored, so I'm doing a bit more obstetric now because life is kind of boring every evening. Okay, how I wish I could do live video every night. But other than the nights that I do live video, I am actually quite bored at home. Okay, so that's why when my patient happened to give birth at this time, I'll probably go and deliver as well. Alright, I want to talk a bit about birth and how it has changed. I mean, from the very first day I started attending birth, and how I have seen a lot of miracles that I have never known all my life as a student in medical school or as a junior doctor. I would say most of my years as an obstetrician, as a doctor, I always perceive birth as a process that is very painful. So I always see mothers in a lot of pain. And even for myself, I still remember my first baby. The moment the doctor say, Yiping, I'm going to put you on a Pitocin drip, and then my thing is, before you put the Pitocin drip, can you give me epidural first? So that's what I had. I had epidural before my drip. So I'm not going to go through the pain. No way am I going to go through the pain. So I have my epidural right from the beginning. So this is how I perceive birth, even right from the beginning. Obstetrics was the reason why I chose to be an obstetrician and gynecology. So it was the very first time when I see births, when I was a student, when I conducted a birth as a student. I loved obstetrics right from the very beginning. So I was one of those early people to decide on obstetrics. I still remember in medical school, we only asked to do 10 births during our entire obstetric posting, but I did 100 over, so I did 10 times more than what was required out of me, because I just love it. I just love just going to the hospital and stay the whole day, whole night until the next morning, do nothing but deliver babies. So I see myself doing that, and I see myself able to do that for the rest of my life. That was why I chose obstetric. Okay, but obstetric to me at that time, yes, birth is wonderful, but a lot of time you see mothers actually in a lot of pain. But through the years that I work, I have seen certain things that make me sometimes wonder and ponder why some women are different. I have seen women on epidural who felt nothing at all, nothing, no pain, no urge, and the baby just came out. The mom didn't push, and the baby just came out. Because in epidural, you have this situation, mother is so comfortable sometimes, especially some mothers are totally pain-free. So when you're pain-free, nurses also don't kacau you all the time. They don't come and keep checking on you whether it's time to give birth, how many cm. Because you're so comfortably, you're there, you're watching TV, you're still so happy. So the nurses normally don't come and disturb you all the time. And then by the time they come to you, in these two cases, they usually, in epidural, they usually check you at a routine basis, like after how many hours, because you don't feel anything, so nobody knows when the baby is coming out. But, so in these two cases that I saw, one of them is first-time mother, probably second or third pregnancy, not first anymore. But both are the same. They didn't feel anything. And then suddenly, out of nowhere, they scream, and then we went there, the baby is out. They scream because the baby came out, suddenly come out, mother got shocked, mother screamed. And then you ask her, did you push? No? Feel anything? No? Baby come out on his own? Baby can come out on his own? So the baby can come out on his own? Then why the hell we're pushing so hard for the baby to come out? Right? You wonder? And there was another situation that I would wish to share is, I have also delivered a couple of babies in ICU, whereby the mother is in ICU. The mother is not conscious at all, maybe got accident, head injury, and the mother is not conscious at all in ICU. And then the mother is pregnant, and then when the time comes, the mother go into labor, and these mothers will still progress, will still deliver. Eventually, you'll be able to see the head. Of course, most of the time when we see the head, we will of course put a forceps or vacuum in and deliver the baby. But think about it, the baby can actually progress on its own. The baby can actually come out its own. The mother didn't do anything. The mother is not conscious. So this is one situation. Another thing I would like to share also, I have this very interesting mother that I will remember for the rest of my life, and I quote it again and again in all my antenatal classes. First time mother, and then she had a bit of signs, birth show, a bit of bleeding. So she decided to come to hospital to check out to see whether she's in labor or not. And this hospital is very interesting. They actually make sure that all mothers who are coming in with signs of labor will be placed on a wheelchair. So they were very nice. They push her on a wheelchair and they push her all the way to the labor room. Labor room is one floor up, so they push her through the lift up to the labor room. And when you reach the labor room, naturally we will ask you to get out of the wheelchair and go up to the bed. And this particular mother, while getting out of the wheelchair onto the bed, the baby just plopped up onto the floor. The baby actually gave birth and came out and dropped onto the floor. Of course, everybody's shocked. Oh my God, baby dropped on the floor. But yeah, put that aside. Think about it. There was no sign. The midwife, being so experienced, got no idea that this baby was about to come out, because the mother did not show anything in her reaction or her face that this baby is going to come out. So is it really possible? First time mother, no pain, no nothing, don't feel anything, and then the baby just pop out? Wow, if all babies were born like that, isn't it amazing? And also there are many incidences that happen in my clinic, because if you have come and see me, you know lah, come and see me, you sit outside in my clinic 2 hours, 3 hours, that is normal. So I have many cases, not just one, many cases, and many of them are also first time mothers, because they do not know they are going to give birth. So they come to my clinic and then they sit in my clinic for 1 hour, 2 hours waiting to see me, and then they never complain that they are in pain. They just nicely sit there, and then when they come and see me, they will say whatever reason they say. Sometimes I feel a bit suspicious. I feel like, is this a case of labor? Then I go and do a vaginal examination, and it's like 7, 8 cm, 9 cm, and then there they are sitting in front of my clinic, not in pain, nothing, never complain, never scream, never shout, never cry. First time mothers. And all these things, these have happened in my clinic so many times. And my clinic doesn't deliver baby, so we somehow have to rush them to hospital. I still remember one case, she was 9 centimeters. I told her, oh, come, pop up into my car, get into my car, we go hospital together. So we go hospital together, and then I deliver her in the hospital. So it's so amazing, right? So these are the things that have happened to actually many mothers. And we wonder why these mothers don't feel anything, whereas some other mothers that you always see are actually in a lot of pain. Okay, why is that so? So then these are the things that I saw long ago, way before I was exposed to this so-called these terms of HypnoBirthing, gentle birth, natural birth. In fact, I never knew these words existed, I never knew these words existed. Then there was this particular mother who came and see me, and she actually told me that she wanted to take HypnoBirthing, and then she had a birth plan. And this was a very interesting mother. Again, it's a first time mother, right? So this was a first time mother, and then she had a birth plan. At that time, birth plan wasn't that popular. I've seen 1 or 2, but not very popular. She's like one of my first few mothers who came with birth plan to me. So she has a birth plan, so I respected her birth plan. I just let it be lah. So do whatever she wants. And then you know what happened? She's a first time mother. She come into the labor ward, and then she's in labor. And then when I saw her when she was 5-6 centimeters, I asked her, how are you? Okay ah? Got pain not? She smiled to me, she smiled to me and said, no pain. I was like, okay, 5-6 centimeter, no pain. First time mothers. Funny, right? But it's okay. Just wait and see. And then after that, a couple of hours later, when I saw her again, and she was like 8-9 centimeter, and I asked her again the same question, any pain ah? And the same thing, she smiled to me and said, no pain. And then finally, after a couple of hours later, midwives called me, they said baby's coming out, and then I went there and then I delivered the baby. But anyway, I was like, no pain. Really? No pain. Okay, so I'm very curious, so then I started researching more about hypnobirthing. Because one thing we know, one thing all doctors know, when we learn about pain relief in labor, there is always such a word called hypnotherapy as a pain relief in labor. We all know about hypnotherapy, but guess what? Nobody taught us what is hypnotherapy. Nobody taught hypnotherapy in medical school or in our postgraduate as well. Nobody taught. It's just a word that you use in your essay. You know, when you ask, the essay comes out, please list or please describe all the methods of pain relief in labor. Then we will name everything, epidural lah, this and then ding dong, everything we will write, and then we will definitely still write hypnotherapy because one more point ma, one more extra mark ma. So everybody knows about it, but nobody knows how it's done. So I was so curious, so I went and researched lor. I went and find out, and then I went to attend talks, and incidentally there was a talk that was given by a hypnobirthing it's not a practitioner, it's a trainer. So I actually attended her talk in one of the doctors conference in Singapore, and that was a kind of amazing but also very curious and wonder what's going on. So well, that's how I signed up. That's how I ended up signing up for hypnobirthing, to be a hypnobirthing practitioner. Got no near one to teach hypnobirthing. Well, everybody knows I don't have time to teach hypnobirthing, but anyway, I was curious how it worked, so I decided to go and pick it up. So yeah, that's how it all started. Then that's how my clinic ended up teaching hypnobirthing. But after I actually had hypnobirthing in my clinic, I saw a lot more miracles. I've seen many women who are, I would say, pain-free or almost pain-free, in the sense that they feel something, but they're fine with it. They're fine with whatever they feel. And many of them, even through 8 cm, 9 cm, 10 cm, and they are so comfortable with their labor. I amazed, trust me, so many people in the hospital. I amazed my midwives, I amazed my labor room sister, I amazed my other doctors, like anesthetists especially, because they are the ones giving epidural, and now they're seeing this group of people do not need epidural and they look like as though they have epidural, you know. So when these people are so amazed, I have seen mothers 8 centimeter, 9 centimeter walking around feeling so happy, so comfortable. When tell them, are you okay? Can you still cope? Yes, they're okay. They don't need painkiller. Then what else I noticed difference in this group of people giving birth compared to the rest? There are a few things that I noticed that makes a lot of difference. Number one is when it comes to breastfeeding, for example. When it comes to breastfeeding, okay, we all know about, doctors know, breastfeeding people also know, there's such thing called as baby crawl, breast crawl at birth. Babies at birth, when you put them on skin to skin, they're supposed to crawl towards the breast. How many of you actually seen such babies? It's very difficult to find these babies, you know. You know why or not we can't find these babies? It's because almost every mother that goes to hospital will be given some form of painkiller that make them so sleepy. And this painkiller don't just make the mother sleepy, also make the baby sleepy. Baby come out so sleepy, how to crawl and find the breast. So we never see these type of amazing things that's supposed to happen in the whole animal world. Every single animal in this world, when it's born, the baby know how to find the breast of the mother. But human baby don't know one. Why? Is human baby so stupid? No lah, because of the painkiller we take. So when you look at breastfeeding mothers, if you leave them on their own, all these babies will know how to find the breast. All you need is skin to skin. You just put the baby on the breast, on the chest, on the tummy. The baby will know how to crawl towards the breast. If you want to look for these things, you can always look at video in YouTube. They always do that. There is such a videos, and everybody in the breastfeeding world knows that. The other thing is, if you are into breastfeeding, you will also know there's issues about nipples. We have women got all kind of nipples, got big nipple, small nipple, flat nipple, whatever nipple. Nice nipples, any baby also know how to suck. When you have flat nipples, inverted nipple, you find the baby sucking, struggling to suck, finding it so difficult to suck. Actually, it's also again because of painkiller. Because the painkiller make the baby sleepy, blah blah. That's why cannot suck. But if you're going to give a hypnobirthing mother, who did not take any painkiller at all, to actually put the baby onto the breast, whatever nipple you have, the baby is going to suck, because it is natural, in its natural state. Every baby has this survival skill, which is the baby knows how to suck because the baby need milk. Okay, so that is a part of breastfeeding. Okay, other than breastfeeding, can you imagine mothers giving birth can still walk around, can still smile, can still talk, can still sing, can do whatever they want? Even at 10 centimeter, I have mothers at 10 centimeter. I see at 10 centimeter, I still see them. I allow them to go and take a bath, go and eat, and then come back and continue giving birth. Can you imagine this type of things done? It is totally possible with hypnobirthing. But why hypnobirthing can and the rest cannot? Why hypnobirthing can and the rest cannot? It took me a bit of time to really understand everything that's actually happening. When you actually sign up for hypnobirthing class, number one, we all sell something. We all sell something in hypnobirthing class, that we sell a certain principle, which is in a way true, but that is not the only factor. So what does hypnobirthing class sell? They sell this concept. They say that the pain is due to fear. Without fear, there's no pain. That is why the mothers who sit in my clinic for 2 hours, they didn't know they were in labor. So they are not scared. Even though they are first-time mothers, they can be 8 centimeter, 9 centimeter dilated, sitting in front of my clinic, because they have no fear. They didn't know they're in labor, so they have no pain. You think about it, mothers in the past who give birth at home. They give birth at home. If you have your mothers giving birth at home, if you still remember your mother who gave birth at home, or your grandmother who gave birth at home, if you hear stories of them giving birth at home, you will know that they were not in pain. They could cook, they could sweep the floor, they could wash clothes, they could hang clothes, they could still do everything they need to do as a mother at home while waiting to give birth. I remember my Indonesian maid also told me that she was still sweeping the floor, and then suddenly she feel like giving birth, she just squat down and then she gave birth. Okay? So giving birth is supposed to be so simple. Then why are everybody screaming and shouting in the hospital? Actually, it's all because of the word fear. That's how this hypnobirthing first started as well. Because the founder of it, the founder of the concept, not the founder of Hypnobirthing Institute, but rather the founder of the concept, which we call Dr. Dick. So what happened is that he was back in, I don't know how long, probably 100 years back. I think somewhere around slightly before World War. I'm not sure World War II. I think before World War II. I'm not exactly sure of the years. I'm not good at remembering the years, but it was a long time ago. Long ago, back in the West, what happens is women who give birth in the hospital, they're actually put to sleep. They give general anesthesia. You really sleep. You do not know what is happening. And then the doctors will put in a forceps and they pull out the baby. Then after, when you wake up, everything is over. So mothers are all given gas when they are in labor. They really do not know what is happening. But only the rich can go hospital. So only the rich will go to hospital and have this facility. The poor give birth at home. So this particular doctor, he actually was called to go to the homes because there was a difficult labor up there. So when you have a difficult labor, mother in labor for many days, baby not coming out, so they will still call the doctor to go and attend. So this doctor went there. This lady is from the slums. They are the poor people in the slums. When he went there, he took all his gas, to go there, want to put the mother to sleep. So when he reached there, then he wanted to give this gas, and the lady looked up at him. Why? Is it meant to be painful? Then he was shocked. Isn't giving birth painful? See, women who give birth at home do not have pain. Then why the women give birth in hospital? Pain. It's all these things that, it's all because of fear. Can you imagine those days? Just think about it, those days. How Malaysia has evolved. Long ago, everybody give birth at home, okay? Everybody give birth at home. Then one day we know it's not safe, okay? I don't want you to give birth at home. We know it's not safe. So we ask you to give birth in hospital. But when we ask the mothers to give birth in hospital at that time, number one, many of the mothers are very young. Those days mothers are very young, 17, 18, no? When you give birth at home, you have so many people with you, You have people who are close with you. You have your mother, your husband, your sister, your brother, everybody at home with you, supporting you. But when you give birth at hospital, those days, they do not allow anybody in. You have to go to the hospital and give birth on your own. They don't allow anybody to go in. You cannot bring anyone. Can you imagine? You're only 17, giving birth for the first time, going to a place called hospital where you hear horrible stories about, and you're all alone, facing birth for the first time, something that you have never done all your life, and you're only 17. What's going to happen? You have a lot of fear. And because of the fear that you have, the pain comes. Every single contraction that happens to you to push the baby out, you consider it painful and unbearable. Whereas your mother who give birth at home find it bearable. Because these contractions, to be honest with you, happens more than once in your life, not just in birth. The same contractions happen when you have sex. The same contractions happen when you breastfeed. But when you're having sex and when you breastfeed, you don't find the pain unbearable. But the moment I put you in the hospital, you find it unbearable. So, and when these people, when they find it unbearable, they go out of the hospital, they tell the whole world. That's what you hear, lor. Whole world tell you, give birth is painful, right? So you believe. So now what happens is, modern mothers believe that childbirth is painful. Because whole world tells you childbirth is painful. The TV tells you childbirth is painful. The newspaper tells you childbirth is painful. So it goes on and you believe. So now, even though you get to bring your husband to the hospital, you can bring your mother to the hospital, but the moment you walk in the hospital, you already believe that your birth is going to be painful. And because of what you believe, that's what you had, lor. So this is the concept that we sell in HypnoBirthing. And in the entire process of taking this HypnoBirthing course, we try to change the perception of every mother. Every mother that takes this course, we try to change their perception to make them believe back what women originally believe. That is childbirth. It is a natural process of the body, just like any other natural process of the body. That means like when you go to pee, you go to poo, it's just a natural process. So because of this, they believe that it's a natural process, and no natural process in our body will cause us so much pain that we cannot bear. And we will have so many testimonials and so many videos to show you about mothers who gave birth via HypnoBirthing, totally feeling so comfortable and pain-free. And one very, very famous example that everybody likes to quote is Kate Middleton. Kate Middleton always appear in the press 1-2 hours after giving birth, feeling so beautiful, fully made up, very cheerful. Doesn't look like she went through hell. Why? Because Kate Middleton took HypnoBirthing, and that is a fact everybody knows. Okay, so that is one thing they teach in HypnoBirthing. And of course, HypnoBirthing is also a course that teach you everything about childbirth. I always say people who take up HypnoBirthing know how to give birth themselves already. But I'm not advising you to give birth yourself. You still need to give birth in hospital. But what is the advantage of knowing everything about childbirth? Because when you know everything about childbirth, you will have confidence to give birth. Knowledge gives you confidence. Confidence makes you have less fear, right? So that is the whole principle about HypnoBirthing course. But is it just the course? No, it's not just the course. Because there are a lot of other things that HypnoBirthing mothers experience that a lot of other mothers do not experience. What it is? We give them a birth plan. We teach them that you have the right to show your doctor your birth plan. And what is it in the birth plan that made the difference? Number one, most hypnobirthing mothers, they do not want so many things done on them. Trust me, if you're not going to do anything to them, that means I'm not going to do so many vaginal examination, example, and I'm not going to break your water bag, I'm not going to put you on the drip. Just by not doing that, I'm not going to put you on the induction drip, the Pitocin drip. Just by not doing that, your contractions are already less in intensity. These are things that doctors do to make you give birth faster. Sometimes some patients, I actually give them an option. I'm not talking about hypnobirthing mothers as well. Others, I give them an option. You want a strong one, fast over? Or you want not so strong one, but will drag longer? So, some of them will say that I want to have a strong one and get over with. Oh, damn brave, this mother. I respect them. But that's their choice. I give it to them. But some mothers will say, I rather don't want so strong, drag longer, as long as I'm still okay. So, a lot of hypnobirthing mothers, because of their birth plan, they already told the doctors, I'm not going to have all these things unless it's clinically necessary. And because now we're not going to do this to you just because we want you to give birth fast. In hospital, that was the routine. That's always what we want to do. We want to break the water bag, we put you on the drip, we get you fast finish. Because hospital always not enough bed, especially government hospital, labor room always full. Quickly give birth, get you out. So a lot of people waiting. So we want to do that. But in hypnobirthing, number one, they already won't get all these things done. So we reduce the pain by that, number one. Number two, we give them freedom. We give them freedom. Just like what government nowadays have, we say hospital rakan, mesra ibu, mother-friendly care services in the hospital, which is something that already given by all hospitals anyway. We give you freedom. You can do whatever you want to reduce your pain. And these are the things they learn in hypnobirthing class. What are the things to reduce your pain? I can do this, my pain will reduce. I can do that, my pain will reduce. I can do this, my pain will reduce. I know a lot of things that I can do to reduce my pain. So these are the things that I noticed that makes a lot of difference to the mothers that give birth in the hospital. So I also can compare two groups of women. There are also many women who they know about all these things because they read. And they also prepare birth plan. But they didn't attend the course. Oh, not the same. Definitely not the same. Because as long as you have not eliminated your fear, and also the confidence to give birth is not so strong there because you never had a teacher who actually teach you how to give birth. Somehow, they can have a birth plan. We can respect their birth plan, but they'll still be in a lot of pain. Just that some of them are really good at tahan, they bear with the pain. But honestly, they are still in a lot of pain. So this group of mothers who attend the class, number one, has this privilege. And there is another thing about mothers who have hypnobirthing. They can do whatever position they want to give birth in. And some of the positions that you choose can actually cause less pain, number one. That is definite. And my favorite position, which I kind of miss actually, my favorite position is still the ones where they go on all fours or crawling, squatting or kneeling, where you are more on your front, your back is above. That is my favorite. And for these women who take hypnobirthing, they have all this freedom. And because they have all this freedom, and they birth a bit different, you know or not? Let's say you are not hypnobirthing. What's going to typically happen in hospital? The nurses will check. And then once you reach 10 centimeter, they will come in and say, push, quick, push your baby out. And then you see, especially for first-time mothers, you will spend minutes and hours, can be half an hour, 1 hour, just to push the baby out. But hypnobirthing mothers, they do not push. Why? Because in hypnobirthing, we do not force you to push. What's the difference? we wait for the natural instinct to push. You don't force yourself to push. So what's the difference? It's like when you have constipation, you know, when you have constipation, when you want to go and pass motion, if you have constipation, you actually force yourself, go to the toilet and push all you want to push, right? Or push really, really hard to get it out, right? That is when you have constipation. But if let's say you don't do that, you wait until your urge to push is so strong. You know, you feel like going to the toilet so strong, you have to run to the toilet. The moment you sit down, everything come out, right? That is the way hypnobirthing mothers birth. Hypnobirthing's mothers birth when it's already going to come out on its own. Just like the ones I said in the earlier part of my talk. The mothers babies just pop out. Mothers on epidural, baby come out on its own. Mothers in ICU, baby come out on its own. Mothers that don't know what is happening and then just suddenly the baby come out on its own. The one that I quote to you, she was just trying to get out of the wheelchair and the baby just dropped out. That's what we want. Because if you have that type of baby, that type of birth, it's so simple. Sometimes you wonder, you know, some people give birth and then push, baby cannot come out, end up go for Caesar, forceps, vacuum. Why? It's all because you were trying to push out the constipated baby. You were not pushing out the baby that was about to come out. So that makes a difference. So you see, the way they birth is totally different. But in order to have this, I call birth, it's not going to be easy. You need a lot of people's cooperation. And not just the way you birth, you know, because you must understand, why I mentioned just now, I prefer the crawling or the kneeling. Not kneeling, but crawling, or kneeling, not squatting, kneeling, where your body is in front of your back is above. Why is that a good thing? Because it reduces tearing. If you don't do a birth plan, a lot of doctors cut. When you cut, you definitely have a wound. If you don't cut, you can still try, don't want to have a wound. There are a lot of things that they teach in hypnobirthing to prevent this wound as well. But not only that, it's the position of which you give birth. Why? Because if you understand our human body, if you know the part down there, our pelvic bone, the back of the bone, our spine towards the end actually curves this way if we are, how would I say? It curves this way if you are, okay, no. Everybody give birth lying down, right? Okay, let's put it this way. When you're lying down, your bone curves this way. So as you push the baby's head go up. The baby's head actually go up. Baby's head go up, then come down. Okay, go up, come down. Not just the bone is curved this way, even your vaginal skin is all curved this way. That is why we always cut this way. So as you push the baby out, the skin also curved this way. So the baby when come out, there is actually a force, a pressure that is pushing it downwards as well, gravity. So it tends to tear. But if you were to be the other way around, opposite, if now you're opposite, your bone is curved this way. Your skin is also curved this way. So your baby is now going this way out, coming out this way, which doesn't press anything on this part of your skin, your vaginal skin, then it's less likely to tear. That's why I like that position. And mothers also give easier in that position because it's easier to come out towards gravity than come out against gravity. So it makes sense, okay? So yeah, so that is why I love that position. But in order to do all these things, sad to say, it requires a lot of cooperation from everyone. It's not just me, it's not just you. You need a doctor that support, you need midwives to support, you need the environment to support. You also need pediatricians to support. And in fact, I think my biggest headache, because I can be in control of myself, I can be in control of my midwives, because midwives on the whole just listen to what the doctor wants. But I can't be in control of my pediatricians because they are another doctor and they have a say towards anything that I'm doing as well. So I have this big hurdle. That's why, to me, ideally, in order for mothers to have this perfect birth, to me, it's a perfect birth. Because you no longer fear birth. You know everything about birth. You walk into the hospital confidently. You know what to do during the entire labor and birth. And birth originally wasn't supposed to be that painful. The pain is totally tolerable. And in order to have that whole thing for you, the whole process, you need what? You need to have the obstetricians, the midwives, the hospital management, and the pediatricians all on the same side, which is not easy to find. I know some pediatricians who are really supportive of this, but they are everywhere. So they are not all in the same place. Ideally, should have a hospital that has everything there. There were a few investors who came and approached me. In fact, this has always been in my mind until now. There were few investors that came, but unfortunately, they come and they go because they're investors. Because when you tell them this, they already start counting money. Natural birth, charge how much? Or these type of people most likely don't end up with Caesar. Because people who do this type of birth most likely won't end up with Caesar. The chances of actually ending up with Caesar are very low. So, they end up don't want to invest, sad to say. Hopefully, this thing will come true. Deep in my mind, is in my heart actually. It's also for my daughter. I always think, if my daughter one day going to give birth, I really want her to give birth this way. I want her to give birth the very natural way, the gentle way, with hypnosis, and hopefully with water birth as well. I want her to have a comfortable birth so that birth is no longer what it was appeared to be on TV and said by everyone. I have brought my daughter to see people giving birth this manner. And I told her, you see, she's not in pain, you see, she's okay. I hope I can change her mind. I hope she believes what I said. But yeah, I really hope such a center will come one day, okay? Alright, I see a lot of highs. I also see a lot of questions. Now it's question time. If you have any question, you can feel free to ask me. Okay, before I answer your question, I just need to update you that MCO or not, HypnoBirthing class is still going on in my center. Yes, I still want to promote my book. I think something wrong with my title. I shouldn't have put cesarean birth. Actually, my book is how to prevent Caesar, you know, it's not to end up with Caesar. Actually, this whole book is how to prevent Caesar. And in this book itself, I will also mention ways whereby HypnoBirthing would have helped a person reducing their cesarean rates, because their chances of having Caesar. In my book is very simple. I quote 12 mothers, first-time mothers ended up with Caesar. Those are not my patients. They tell me their story. In Malaysia, they're all mothers from Malaysia, and then I explain how this Caesar would have been prevented, and in many instances HypnoBirthing would have helped. Okay, so all of you who have not attended HypnoBirthing class, maybe you can start doing so. Okay, somebody asked about induction. Okay, let me debunk this myth. Okay, induction very painful? Nonsense. Okay, why? Because at the end of the day, it is still boiled down on the same thing, which is contraction. If you believe contraction is not painful, then the contraction, whether it's natural or due to medicine, is also not painful. But there is a difference. Because induction we use medication, right? In medication, we actually can decide the dose. So if you were to ask me, if I'm going to induce a mother, and especially I know this is going to be a hypnobirthing mother, what's the difference when I induce a hypnobirthing mother and I induce someone who is already decided going to take epidural? Okay, the difference is, if I know you are going to take epidural, oh, I induce gao lah, high dose, fast, get it over. Okay, you're going to be epidural ma, you don't feel anything, right? Even sometimes some mothers, I didn't induce that strong. I induced like moderately, but suddenly they say, Doctor, this mother says she wants epidural. I say, okay, once epidural, please up the induction, because she's not going to feel anything anyway. Let's go all out. Okay? But if I have a hypnobirthing mother, I play slow. I play low dose. If I play low dose, you won't be surprised. I have mothers who told me that the induction is less painful than the hypnobirthing. Than the natural birth. Because she had multiple births before, she had natural birth, she had induction. The induction is less painful than the natural birth. Why? Because in natural birth, you cannot control the contractions that come. But in induction, it's totally controllable. So it's not necessary to that induction is very painful. No, it's again a myth. It's again something somebody tell you and you believe in it. And the more you believe in it, the more it's going to be true. Okay? So, yeah. Sarah asked, is there a drug-free but pain-free birth? I just mentioned, if you're going to do hypnobirthing, but you need to do it. It's not just about attending the class. You really need to be able to do it effectively. Of course, I wouldn't say 100% of all mothers do it effectively. Very much depends on the class, the teacher, and the student. And of course, you need supportive doctors, midwives. Yes, I've seen tons of drug-free, pain-free birth. But you need to really take up the course and really absorb everything that is being taught, and also to believe 100% that that is true. If you can't believe, then it's not going to happen. Okay, not many questions except a lot of testimonials here. Everybody talk about how exciting or how great they had the birth that they had. Okay, so yeah, but I think I did see some questions. Yes. Although I would say, yeah, you need doctors to be supportive, but in some ways, it's not as ideal now today. But even mothers who give birth in the hospital, I still feel that taking hypnobirthing class is better than not taking if you're going to a government hospital. Because government hospital, you can't expect doctors to be supportive most of the time, but it is still better because knowledge is one thing. Once you have knowledge, a lot of things makes a difference. Because nowadays we have a lot of mother-friendly care in hospital, government hospital. They give you a lot of freedom. They give you freedom, you do what you want. Okay? Alright, yeah, a lot of doctors still do episiotomy, even though you see it's the same thing with this COVID-19. A lot of guidelines say COVID-19 can still go for natural birth, but you're still going to see a lot of cesarean. A lot of guidelines say that mothers can breastfeed babies if you're COVID-19 positive, but you're still going to see babies being isolated from the mother. Sad to say, yep, I may not totally agree with everything, but yeah. Yeah, Jessie Chia asks, do you mean that kneeling is the best position to avoid tear? Yes, kneeling and all fours. Yes. I've seen so many mothers in that position and I love to have that position. Yep, Lillian mentioned that choose your gynae and peds wisely. Unfortunately, yes, as a private hospital, you can always choose your gynae. But peds, again, you need to see which hospital. Many hospitals do not allow you to choose your peds. Sarah asks, if you induce a baby because you want a baby to be born a certain date, is it safe for baby? I mean, all induction has a certain risk involved. So nobody would induce unless you have a good reason to induce. Your reason to induce have also to have, you have to weigh the risk on both sides. Phoebe Lim say, how can this method be implemented in government hospital? As I said earlier on, now government hospital all have mother-friendly care. So mother-friendly care means you're given a lot of time to be on your own, to do whatever you want. So you take up the course, you know what to do, then just do what you want. Okay? You may not have the 100% of an entire birth plan followed in a government hospital, but I believe more than half definitely you can get. Why do mothers need peds to agree on this hypnobirthing plan? Yes, they need to agree. They need to agree. They need to agree a lot of things. Because let's say, will they agree with skin to skin, immediate skin to skin? Do they agree with 1 hour of bonding? Number 2. Number 3, when your water start leaking, will they agree that you were to leave the baby in your tummy for 1 day, 2 days? They don't agree. I have this hospital that came and tell me upright, Dr. Tan Yiping cannot give birth in this hospital. Not the hospital don't let me give birth. Pediatricians say if Dr. Tan Yiping's baby give birth in this hospital, all the babies will not be seen by pediatrician because hypnobirthing mothers wait too long. We don't want to take the risk. Okay, so they don't understand. They have a lot of fear. Pediatricians can reject hypnobirthing. They can reject because they want to be given all the injections at birth. They can be rejected if they want to take the baby away from you. I have pediatricians who insist that babies have to be sent to the nursery immediately after birth. Pediatricians have a lot of role in your hypnobirthing. Okay, it has. Okay, don't ask about water birth. It's not in my hands. I think in a way I don't see water birth coming back in a short duration of time unless we can convince someone to let it come back. When is the best time to start hypnobirthing course? Anytime after 5 months, I say would be fine, as long as you're no longer vomiting. Anytime after 5 months, 4 or 5 months. Is it suitable for someone who is not pregnant but trying? Oh, no lah, you pregnant first lah, no point you go for the class now. Jing Tian asks, I have my first baby through C-section because my baby is not engaged. My doctor told me I have ectopic uterus. I had heavy bleeding during my first C-section. Oh, okay. I cannot have VBAC for my second child. Is it true? This is not for me to say. In a way, sad to say, we always take the doctors who operate on the first pregnancy to say everything. But of course, this is what the doctor tell you. But whether the doctor would say that to everyone, because sometimes you see, like government, I love them. You know, they have a red book, and then if you have any complication, at the end of the red book, one of the last few pages, they will write there, not for vaginal birth in next pregnancy or for Caesar in next pregnancy. So the government made that recommendation. The doctors wrote there, and anybody who read it, I believe no doctors would say no to this. But if you're in private, then I have a lot of big question mark lah, what is actually happening. So, because anyway, a lot of private doctors do not allow all kinds of funny situations to go for natural birth. So if I were you, what I would do is, number one, I will get a medical report from your first doctor to explain everything and his recommendation. Because if, let's say, he were to write a report and he say because of these reasons you cannot have a natural birth in your next pregnancy, then no choice, all of us have to follow. But he just explained your situation, but he never say anything. And sometimes why he never say the recommendation, because he knows actually you can have natural birth one. It's his opinion. He doesn't want to support you if you want to go for natural birth, that's all. Because in the first place, Jing Tian, your first Caesar was not a reason for Caesar. There's no such thing as Caesar because baby had not engaged, okay? There's no such thing. So obviously you went to a doctor who prefers Caesar. So your doctor who prefers Caesar will always recommend Caesar. That's why I always say in all my talks, I have so many live videos so far, my advice has always been the same. Choose the right doctor, okay? Okay, my book. If you want to buy my book, you can always still order it. Yeah. If you ask about my book, yeah, Fatin, you can always order it from my website. You can go to my website, or you can actually browse through my Facebook. On and off, I advertise my book. You can just buy it through my Facebook as well, okay? So you can buy online, no issue. What is the website? The website is www.citywomanandchildclinic.com. citywomanandchildclinic.com. So website is very easy to remember. It's my whole clinic name. Alright, since there's no more questions, so yeah, thanks for staying up. Watching my video today. Okay, do stay tuned for my future live videos. I will be having many more live videos as long as MCO is on. And yeah, I just delivered one baby 2-3 days back, hypnobirthing mother, and yes, it was an induction because she's past her due date, and she also doesn't want to wait anymore. And so we induced, but it wasn't that painful at all. I saw her so many times and she's still very fine with it. She's sitting on her birth ball. She didn't require any form of painkiller at all, and she's very well throughout, even though induced. So actually induction can be adjusted. We can adjust those one, okay? We can adjust those so that you don't even feel much. It's not really a problem. Okay, so do stay tuned to my browse through my Facebook to see what's my next topic. I haven't decided what I'm going to do this Friday. If you have any suggestion, please post it up on my Facebook, what topic you want me to talk. So let's see which topics have more demand. I will usually talk on topics that has more demand, okay? Okay, that's all for now. Thank you. Bye-bye.